For some 30 years now, this great city and this great state have been the epicenter of a plague that has destroyed tens of thousands of lives. Some 10 years ago, we began to see glimmers of a path to bring the AIDS epidemic to an end, even without a vaccine or a cure. It wasn't a lack of science that has kept us from doing so. It hasn't even been a lack of resources. It has been a lack of political will. But over the last several years, some remarkable things have happened. Under the leadership of Governor Andrew Cuomo, Medicaid has been reformed in New York State, and whatever you think about the particular elements of it, it has freed up resources to be redirected to improve health outcomes. And what better way to do that than to end AIDS as an epidemic?
Is here on behalf of Governor Cuomo, who sends his greetings today. And I want to acknowledge what the New York State Department of Health AIDS Institute has done for the last 30 years. It was Governor Andrew Cuomo's father, Mario Cuomo, who created the AIDS Institute. And 30 years on, they've done extraordinary work, so extraordinary, in fact, in helping our community fight this disease, that New York is doing better in terms of treatment and care and prevention than almost every other state in the nation. So I want to acknowledge Joanne and Governor Cuomo. I also want to follow on what Charles said with regard to our political leaders. We have an extraordinary opportunity with a new city council here in New York City, a new mayor, a progressive vision for New York City, and we need to be explicitly part of that progressive vision. We need to get our political leaders all in on ending AIDS. This is completely doable. As Charles noted, this is entirely about political will and targeting our resources where we know the epidemic lives to bring it to an end. And that's really about leadership. So I sign on with Charles and with all of you here today in urging Governor Cuomo and Mayor-elect Bill de Blasio to help us end this epidemic now.
So many people, so many New Yorkers, 100,000 New Yorkers who have died of HIV/AIDS. We have to think about that today. We have to think about the 35 million people in the world living with HIV/AIDS. We have to think about that today. We also have to think about what we're going to do to stop new infections, what we're going to do to find a cure for HIV/AIDS, what we're going to do to make sure that everyone who needs drugs, who needs social services, has access to health care. You know, this is a public health fight, but it's also about human dignity. It's about human rights. And the people who are impacted most, let's face it, the people who are impacted most by HIV/AIDS are the people who these companies may not care about every day. The people in the shadows, the invisibles. The statistics show minorities, women, people with low income have higher rates of infection than anybody else in our society. We have to do something about it. And I need your help when I go up to Albany in January. There's a bill that I am so proud to carry. And I'm having a lot of help from GMHC and Vocal and Charles King and a lot of other advocates. It caps the rental income required to 30%. Let's hear it. 30%, 30%, 30%, 30%, 30%.